In this presentation, we're going to talk about influenza virus, which is one of the most prevalent viruses worldwide. We're going to tackle multiple points, starting with the definition and types of influenza virus, risk factors, pathogenesis, diagnosis, medical tests, treatment, exercise interventions, nutrition therapy, and most importantly, prevention. Our target population is the general population with both ages and genders, as any of them can be infected with influenza virus, although the attack rate may differ to be lower in the adults. Moreover, children constitute an important link in transmission chain. On the other hand, during epidemic and pandemic attacks, the highest mortality rate was recorded among old people, which are over 85 years, children under 18 months, and those with systemic diseases such as chronic heart disease, respiratory diseases, renal disease, or diabetes. That's why people must be aware of influenza virus regardless if they're old or young, male or female. First of all, we're going to talk about the definition and types of influenza virus. Influenza, which we all know as a flu, is caused by RNA viruses leading to an infectious disease which is transmitted by air upon sneezing or coughing. Its symptoms start to appear 2 days after being exposed to the influenza virus and continue to be present for less than a week. There are four types of influenza virus, types A, B, C, and D. Out of the four types of influenza virus, only three of them affect human beings, which are types A, B, and C. Type D usually infects pigs and cattle, although, according to researches done, it has the potential to infect humans. However, no cases have been reported yet. Types A, B, and C have only one species. The three of them infect human beings. Type A infects animals as well. It's made up from several serotypes according to their antibody response, H1N1 and H3N2 being the most encountered by human beings. This type is transmitted to different species, giving rise to pandemics and epidemics. Moreover, it causes antigenic drift and shift. Type B mostly infect humans. It's less common than type A influenza, mutates 2 to 3 times slower, and is less genetically diverse as it has only one serotype, so there is only one antigenic drift for this type. No human influenza pandemics have been recorded due to type B influenza. However, it causes outbreak and epidemics. Type C infects pigs in addition to humans. It is not common as type A and B. It causes mild illness and antigenic drift only and doesn't cause epidemics.
You recently learned about some of these severe complications of influenza, particularly pneumonia, which can lead to respiratory failure and, in some cases, even death from the disease. There are certain populations to a higher risk from others to develop severe complications of influenza virus. Those patients at extreme of age, elderly and infants, are at highest risk for infectious complications from influenza. The infant's immune system is immature compared to adults' immune system, and this has a critical impact of susceptibility to respiratory viral infections. In older adults, immune system become weaker with advancing age. This puts adults over 65 years old at greater risk of severe disease from influenza. Pregnancy has long been recognized as a risk factor for influenza related morbidity and mortality, and data has actually indicated that pregnant women have a 3 to 4-fold increase risk for influenza related hospitalization or even death compared to non-pregnant women.
Influenza virus spreads from person to person primarily through large particle respiratory droplet transmission. In other words, when a person coughs or sneezes, virus can exit the infected person and enter a new host. Transmission generally requires close contact between source and recipient person since droplets generally travel only for a short distance. Contact with contaminated surfaces is another possible source of transmission, as the virus can live on non-porous surfaces from 4 to 8 hours and on clothing up to 12 hours.
As for the pathogenesis, once the virus is inhaled, neuraminidase helps to degrade the protective mucus layer, allowing the virus to invade the host tissue by gaining access to the underlying respiratory epithelium. Upon making contact with the cell surface, hemagglutinin binds sialic acid receptors on host cells, allowing the virus to enter in vesicles. Once in the cell, viral encoding occurs. Then, viral genome moves into the nucleus where replication takes place. After that, viral RNA polymerase transcribes the genome segments into messenger RNAs. Most of these messenger RNAs enter the cytoplasm where they will be translated into viral proteins. Newly formed proteins assemble forming virions, which are released from the cell by budding from its membrane at the site where hemagglutinin and neuraminidase are located. It's important to mention that the neuraminidase acts to release the virus by cleaving sialic acid at the cell surface. Thereafter, virus is freed, affecting neighboring cells. Also, virus ultimately kills host cell as it replicates, often leading to widespread necrosis of the superficial layer of the respiratory epithelium. Although acutely debilitating, influenza is a self-limited infection in the general population. However, it's associated with an increased morbidity and mortality in certain high-risk populations. Influenza characteristically begins with abrupt onset of fever, headache, myalgia, and malaise following an incubation period of 1 to 4 days. These symptoms are accompanied by manifestations of respiratory tract illness such as non-productive cough, sore throat, and nasal discharge, gastrointestinal illness such as vomiting and diarrhea, which can occur in 10 to 20% of influenza infections. As for the complications, the major complication of influenza is pneumonia, which can be classified into primary influenza pneumonia, which causes respiratory failure in 10 to 20% of the cases, and secondary bacterial pneumonia, which is responsible for a mortality rate which ranges between 5 to 10%. Organisms isolated in secondary bacterial pneumonia include strep pneumonia, Staph aureus, including MRSA, and even nosocomial gram-negative organisms. Other complications, such as CNS diseases, may be associated with influenza, including encephalopathy, encephalitis, transverse myelitis, and even Guillain-Barré syndrome. It's important to mention that Ray's syndrome may also be associated with influenza. It's characterized by rash, fever, liver failure, encephalopathy. It's thought to be due to concomitant use of aspirin during the course of influenza. Also, we have myocarditis and pericarditis, and other complications include myositis and rhabdomyolysis.
One of the exciting developments in the laboratory is the ability to diagnose respiratory viruses, in particular influenza. In the past, it took 4 to 6 weeks because we measured the immune response and antibodies. But now we can detect it directly using newly developed genetic assays. We started the methods. First method here, rapid influenza diagnostic test, known as RIDT. It tells whether the person has a current influenza by detecting the influenza viral nucleoprotein antigen. It takes less than 15 minutes. The other method is rapid molecular assay. It detects influenza viral RNA or nucleic acid. It's also for A and B. It takes time from 15 to 30 minutes. Okay. The other technique here, immunofluorescence, it can be direct or indirect. It's also for type A and B. It takes 1 to 4 hours, whereas the PCR, it's also for type A and B. It varies from 1 to 8 hours. The other methods here, rapid cell culture and viral tissue cell culture. They are for type A and B. It takes 3 to 10 days. Viral tissue culture, whereas the rapid cell culture takes 1 to 3 days. Okay, we must consider the acceptable specimens. Specimens in all techniques must be swab, aspirate or wash, nasal swab, It can be either throat swab, bronchial wash, nasal endocrine aspirate, sputum. These specimen can work on these methods.
Concerning the pharmacological treatment, the flu treatment depends on the symptoms. If the person is experiencing any nasal congestion, he will be prescribed decongestants in oral or nasal spray forms. If the person has any runny nose, he is prescribed antihistamines. If he had persistent cough, he will use cough suppressant and expectorant. If he had any fever or body aches, he will be prescribed acetaminophen or medicines like ibuprofen and naproxen. If he has any sore throat, he will be prescribed medicated lozenges and gargles. Studies show that flu antiviral drugs work best for treatment when they are started within 2 days of getting sick. FDA approved antiviral drugs oseltamivir, which is under the name Tamiflu, zanamivir, which is under the name Relenza. Oseltamivir and zanamivir are prescribed to be taken twice daily for 5 days. Side effects of these antiviral drugs may be nausea, vomiting, runny nose, stuffy nose, cough, diarrhea, and behavioral changes. Zanamivir is not recommended for individuals who have asthma, COPD, or any other lung diseases.
And now regarding the exercise intervention for patients with influenza, there are many interventions that can be taught by physical therapists, and they can improve the pattern of breathing, they increase the secretion of mucus, and also decrease congestion. Although those interventions are not the direct treatment for influenza, but somehow they definitely can relieve the symptoms. For the first breathing exercise, which is called deep or diaphragmatic belly breathing, in this exercise, what you're going to do is you have to place one hand on your abdomen just under your breastbone, which is called the sternum, and now you slowly breathe in through your nose and feel your belly rise into your hand. Now here's a note. You have, before you exhale, you have to purse your lips and slowly breathe out through the pursed lips and feel your belly fall away from your hand, just like the picture. You can do this exercise in sitting or lying position, whatever comfortable you, and repeat it maximum 5 times. For the second breathing exercise, which is called pursed lip breathing, in this exercise, you have to follow these instructions to perform the exercise easily, just like in the picture. I ask the patient to inhale slowly and deeply, then instruct him to purse his lips before exhalation. Now he's ready to relax the air out through the pursed lips, but make sure not making any abdominal contraction. Then direct the patient to stop exhalation whenever the abdominal contraction is felt, and at the end hold between inspiration and expiration with the permission of abdominal contraction.
Postural drainage is preferred to be done by a healthcare provider, either a physician or a physical therapist, although it can be done by the patient's family after adequate training. What is postural drainage? It's the process of positioning patients to best utilize the gravitational effects to enhance removal of secretion. How do we do it? We place the patient in a specific position that depends on which lobe we want to drain. After we position the patient, the physician uses percussion or vibration on the patient's chest to break up secretions. Then the patient secretes the mucus, or we can also use a suction to collect these secretions. This process is done for a maximum of 20 to. Okay, so other interventions for influenza. We all know the muscle aches associated with influenza. We can use massage or heat on the painful or aching area, or stretching the aching muscle. This will help in relieving the muscle ache. Now, after full recovery, always remember, even if you fully recovered from influenza, exercising daily helps improve your immunity and thereby decrease the risk of further infections. So, when you're not feeling well, don't exercise, don't do your regular exercise. You should still do your breathing exercise though, and contact your doctor as advised on your individual action plan. And thank you.
I'll be talking about medical nutrition therapy. It's certainly okay to eat a little with the flu, as you likely have a reduced appetite. Still, you'll need to eat small amount of the right foods to provide you with energy and nutrients while you recover. So there is no specific diet for patients with influenza. However, it should be a balanced, healthy one, and where you are educated about food that you can eat and food that you should be avoiding. Okay, starting with protein and energy. Meeting protein and energy needs helps to minimize losses of muscle tissue and weight. Protein intake should fall between zero point 0.8 and 1 gram per kilogram body weight per day, and energy intake should be imbalanced with the energy expenditure to avoid unintentional weight loss. Now, fat, reducing the amount of total fat intake to less than 30% of total energy intake, reducing saturated fat to less than 10%, and reducing trans fat to less than 1% of total energy intake. And finally, replacing both the saturated and trans fat with the unsaturated fats, which are known as the healthy fats, polyunsaturated fat, and monounsaturated fat. Moving forward with sodium, sugar, and fluids. Sodium, keeping salt intake to less than 5 grams per day. Sugar, the intake of free sugars should be reduced to less than 10% of total energy intake. And finally, fluids, stay hydrated since it's easy to get dehydrated with the flu due to less intake of drinks and sweats from fever. Therefore, increase intake of water, 8 to 12 cups per day, or drink tea, broth, and 100% fruit juices. Okay, vitamins and minerals. Patient with influenza virus may require taking vitamin A, vitamin B6 and B12, and vitamin C. Vitamin A strengthens the mucous membranes, making them more resistant to infection. Vitamin B6 and B12 help regulate metabolism. And finally, vitamin C stimulates antibody response, and regular use can prevent colds before they even happen. I'll be discussing the food that you should eat and the food that should be avoided. For foods to be eaten, we have garlic, yogurt, vitamin C containing fruits, and leafy green vegetables. Garlic and yogurt both were found to be enhancing immunity and reducing the severity of symptoms. And for the vitamin C containing fruits and leafy green vegetables, both contain vitamin C and some contain vitamin E, which are immune enhancing nutrients. For foods to be avoided, we have alcohol, caffeinated beverages, hard or jacked foods, and processed food. Alcohol, this lowers your immune system and causes dehydration. Similarly, caffeinated beverages like soda, coffee, black tea can make you also dehydrated. Hard or jagged food, crunchy crackers, chips, and foods with similar texture can aggravate cough and sore throat. Finally, processed food. The more processed a food is, the fewer nutrients you'll get. With the flu, your body is trying to heal itself, so it's important to support the process with whole, nutritious foods. Thank you.
And most importantly, people must be aware how to prevent and protect themselves from being infected by influenza virus. Different strains of the flu virus mutate over time and replace the older strains of the virus. This is why it's important to get a flu shot each year to ensure that your body develops immunity to the most recent strains of the virus, keeping in mind that it can reduce the risk of being infected by 60%. Moreover, you must practice good health habits as it can act as an important line of defense against influenza virus, such as washing your hands, which can often help protect you from germs. If soap and water are not available, use an alcohol-based hand rub. Cleaning and disinfecting frequently touched surfaces at home, work, or school, especially when someone is ill. Getting plenty of sleep, being physically active, managing your stress, drinking plenty of fluids, and eating nutritious food. Eating healthy and balanced meals to strengthen your immune system is a step that must not be underestimated at all. Moreover, exercising boosts your immune system and speed recovery from illness. Quitting smoking could be a useful preventive measure against flu, not only for you but also for your children, family, or anyone else who lives with you. Moreover, covering your mouth and nose when you cough or sneeze is an important step to prevent spreading this infection. And finally, staying at home and getting a full mental and physical rest until your fever is gone for 24 hours is all what you might need. And thank you for listening.